I just laid down that night and just dozed off, and I heard this horrible noise, a real loud bang. And I said to my son, I said, "Was that thunder?" And he said, "No, it was a wreck, and it's on fire in front of the house." So we went down and got the fire out. I reached in, touched his jugular vein, there was no pulse, nothing. And the only thing I thought we could do and said to do was pray for him, pray for him. And that quick, he took a real deep breath, started breathing, lifted his arm. Till then, the ambulance was there, the fire trucks was there, the EMTs was putting the IVs and stuff on him. The fireman was cutting the roof off, got him out of the car, on the stretcher, and in the ambulance in 13 minutes, and got him over to the chopper.
We typically fly over 120 knots, which is well over 100 miles per hour on the ground. We were able to get Caleb to Conemaugh well within the golden hour of 60 minutes. Many people refer to MedStar as a flying ICU, and that is exactly what we are.
It was unbelievable the amount of injuries that Caleb suffered. Traumatic brain injury, a life-threatening aortic aneurysm, a collapsed lung, broken ribs and sternum, laceration to his liver, kidney, and spleen, a compound fracture of the femur with fear of amputation, and burns to his shoulder, arm, and hand.
Seeing your brother laying in a hospital bed with numerous amount of machines that are keeping him alive was very horrific to see.
The trauma center at Conemaugh is uniquely skilled and equipped to handle seriously injured trauma patients like Caleb. This kind of success really requires continuous commitment and dedication towards excellence in patient care. Trauma is not something that you have the opportunity with do-overs. You got to do it right the first time, and we spend a lot of time and effort preparing the pre-hospital people, our emergency staff and our trauma staff to react quickly so that everything happens seamlessly and without hesitation.
Caleb did not lose his leg, which we are very, very thankful for. Everything worked out so well at Conemaugh and with the rehab, and he is doing so great. He is back to work full time.
I'm definitely thankful for Conemaugh Trauma Center for just being alive and treat me very well. I have really no trouble in my daily life. I'm just really appreciative of it.
We just marvel at the miracle that saved our son, that God put all the right people in the right place at the right time. It took an entire town and a helicopter to get my son to Conemaughl's trauma unit when precious seconds mattered.
My first heart attack was at 29. Since then, I've had 11 stents in my heart. I've had a heart ablation, coded 3 times. I'm in the heart failure program down here. I'm getting an IV now to get rid of fluid. Whenever I was in ICU, I had my thing where I was not to be resuscitated. And all the nurses told me, you know, you're way too young to just let die. I'm glad they did. They really talked to me to talk me out of it. My cardiac doctors is Lou Manstrini. They all treat me great. Down here at the heart failure program, I see Jamie Penrod the biggest part of the time. She is so easy to deal with. We joke back and forth. She treats me like family. I highly recommend the cardiac failure program because it keeps you out of the hospital.
I just looked at William and I just started crying. I was only 25 weeks and we didn't know what was happening.
I felt a sense of relief when Dr. Kazami looked at me and gave me a thumbs up that the surgery went well.
Those PAs, those doctors, everybody, Dr. Shell and her entire team, Dr. Kazami and their entire team, they're amazing.
So once they were off oxygen, we felt like they were okay, but it was 5 months until we felt that way.
This is our firstborn son. This is William Ronald Polacek.
And this is Oliver Joel Plachek, and they both just celebrated their first birthdays. They're normal, healthy babies, so they're really doing great.
So many emotions. We were worried, was it going to be a good, bad outcome? We weren't sure. We prayed a lot.
It's hard to watch your son and daughter-in-law go through the pains of seeing this 1 pound, 11 ounce baby that you could barely recognize with all these wires and ventilators going through their bodies and the feeding tube. I always felt that Conemaugh was, a hospital that really cared about their patients, but I was never exposed to the NIC unit. And the NIC unit is a special place. They monitored every little detail. I mean, if something was off by 1%, they changed it. And they just didn't look at these little infants as patients. They were like their own children. And you saw that love and that care. We knew we would get the best level of care we could get.
No matter the season, we're always in full swing. When it comes to cutting-edge orthopedics and sports medicine, Conemaugh Health System is your winning team. This all-star team is scrubbed and ready all year round. Whether you're sidelined by a sports injury, undergoing surgery, or dealing with a traumatic injury, Conemaught's team will get you back in the game. From life-saving trauma care to advanced orthopedic procedures, we're here to get you back to your best, no matter what life throws your way. Our MVPs, our surgeons, performing at their peak when every second counts. And our playmakers, those who make the valuable assists, our practitioners, our nurses, and our staff, ensuring you get the best care and stay on track toward your optimal recovery. When your health and mobility are on the line, we provide championship-level care because your health is our victory.
I realized that something was significantly wrong because I was a little lightheaded. I was not seeing as clearly as I thought that I should. I didn't know if that was attributed to fatigue or stress, except that my heart began to flutter a bit. Something just told me that I needed attention immediately. My luck was that Dr. Matt Perry was running the emergency room that night. He told me that he had to resuscitate me twice. Dr. Nathaniel diagnosed me with a stress-induced cardiac failure. And I did need a catheterization, and I do follow up with him every year. My follow-up after my cardiac event included cardiac rehab at Conemaugh, and I came several times a week, and the care there was also amazing, just absolutely amazing. As I was driving to this interview today, I saw the signs that said that Conemaugh was designated the 2023-2024 high-performing cardiac care hospital. We're so very lucky to have it that of course I recommend Conemaugh. I am a walking, talking success story of Conemaugh Hospital.
A day in the life of an ER doctor is one of many unknowns.
It's something that can't really be put into words. It is heartbreaking. It is challenging. It is stressful. It is happy.
Things happen suddenly. A lot of people are sick. Accidents happen. Traumas happen.
To these people, this is their worst time and their darkest time.
When you come into Conemaugh, you're being cared for by people that have invested their lives in you and in emergency medicine. We want to do what's best for you.
We do have the manpower to see patients quickly, efficiently, effectively, safely.
The people at this hospital are dedicated to serving this community, and I think that there's really no other place like it.